First. Give me a pay.
Pay! You like that, Jabari? Jabari?
For quick transfer with just an email, mobile number, or QR code, use First Pay from CIBC Caribbean. Visit CIBCCaribbean.com/ways to bank for more information.
If you live in low-lying areas, be aware of the possibility of tsunamis immediately after an earthquake. A strong earthquake lasting 20 seconds or more is a natural tsunami warning. Do not wait for an official warning. Gather your family members and evacuate immediately after the shaking stops. Don't delay. A tsunami could occur within minutes.
This message is sponsored by the Australian Government, AusAid, and produced by NEMA in collaboration with Win FM.
Why? I try to grow my business, but every time I check, getting a loan feel like a dead end.
Because you're financially ready. What you need is the Ministry of Small Business and Entrepreneurship's Building Bankable Businesses program.
What?
Building Bankable Businesses. It's a financial literacy boot camp to show you how to manage your business properly and put yourself in a better position for financing.
But you know how the banks stay. Getting through ain't easy at all.
Yeah, but that's why BBB different. So just finish the program and you get VIP treatment to help qualify for National Bank's banking on small business loan. And guess what?
Well, that you sound like something I need. Why? Wow.
So when all the details drop, make sure you sign up.
Get ready to grow with the Ministry of Small Business and Entrepreneurship and National Bank. Building bankable businesses. Building bridges to financial solutions.
Unlock the secrets to a healthier you. Join Dr. Natalie Osborne every Tuesday at 8:30 a.m. on Win FM 98.9 for Weekly Dose. During this 30-minute health discussion, we aim to educate and empower our listeners on the prevention of diseases, early diagnosis, and timely intervention. Don't miss out on this informative health talk where we teach you to live your best life. Weekly Dose, Tuesdays on Win FM 98.9.
Welcome to Island Tea with your faves. Keep it locked in with us for your daily dose of hot tea only on Win Media 98.9.
And good morning and welcome back to Island Tea. And you know this is the time for a weekly dose, and we have with us in studio the lovely Dr. Natalie Osborne, and today's topic is habits that secretly annoy your doctor. So listen to find out, okay? Don't just take the topic and run away. Listen, and we can all learn today. Good morning, Doc. Welcome back.
Good morning, Cartencia. Good morning to everyone who's listening out there. It's always great to be here on a Tuesday morning. This is our meetup time, Cartencia.
Yep, indeed.
Yes, so habits that secretly annoys your doctor. It's not bashing on any patient at all. Ultimately, is to ensure that we get the best out of the visit that we have with the physicians. So what physicians around the world have been saying is that your own behavior can get in the way of your getting the best and the highest care possible. So it is important that you go in with the right mindset. And so there's a low rate of physician satisfaction in recent days, and lots of physicians are leaving the clinical practice and going into research or other areas where they do not have to deal with patients on a day-to-day basis. This is why this is important. And there is a shortage of physicians as the data states from the United States. Yes, and so in many areas you have a shortage of family physicians. And so hence your visit to your doctor is much delayed. Persons have a long wait time to get in to see their physician, get in to see a specialist because of all of this. So our discussion here today is not just to hurt or upset anyone, is to ensure that we get the best out of our visit with our doctor, because being a physician can be very overwhelming at times, Cartencia, and physicians are reporting lots of burnout. So how can you meet your physician halfway? So help them to help you. So that is what today's discussion is going to be about ultimately. So there's a lot of research went into this, so we're going to go right in and discuss some of these habits, Cartencia. And of course, you would be on the side of the patient, and then if you have any pushback, you would then make your comments known.
Indeed. Not coming prepared. I'm trying to understand that.
Okay, so not coming prepared. That is one of the biggest issues physicians complain about to the doctor. Your time is limited with the physician, so your preparation is important at that point. You want to have all of your necessary medical histories, all of your necessary drugs, whether you take an image of on your phone of the different medications that you have, okay, or you bring the containers or the labels with you, so they're quite aware of that, okay. You want to ensure that you have a list of all your healthcare issues. If you were referred by a different physician, you want to ensure that you have any laboratory results, any ultrasound tests, because it makes your time there with the physician as effective and efficient as possible, because you know that you're coming in prepared. The doctor can look at all of your results and help to get to a conclusion in a timely manner and to be as effective as possible. So that is why coming prepared is very important.
Okay, and now that makes plenty of sense. My head hurts, my hand hurts, my foot hurts, but I came to for my stomach. I'm trying to cover too many problems all at once. How can you deal with that?
Yeah, trying to cover too many health issues at once. I want to ensure that our audience understand. You have medical issues and you have medical complaints and you have associated symptoms. For example, Hortensia, I'm having abdominal pain, and it might be an acute appendicitis. So you have abdominal pain associated with nausea, vomits, with fever. Those are associated and related. But that's not what happens at times. Patients come to see their physicians, and they want to cover everything because they haven't seen their physician in over 2 years. And they say, since I'm here, doc, I had a swelling to my foot 2 weeks ago, but it's actually gone now. And what about the chronic pain that I had? I had some pain in my back, and it is not related. Why can this be harmful? Because it distracts away from the main complaint. What if you have a true abdominal pain and you have acute appendicitis, but then you randomly mention that there was a swelling to your toe, or you have a bump on your toe, and we get distracted. So we have to make the main thing, because patients can have their own agenda. And I said, since I'm going in here, I want to make sure I get everything out of the doctor, and I want to cover everything. That can lead to miscommunication and mismanagement. So you understand me on that one. So let's make the main thing when you get there.
But what would they do with all the other pains for those who Let's talk about lying about our medication and the habits. I know some people get medications from the doctor. They take one. It makes them feel funny. They don't take it anymore.
Yes. So in truth, your physician is not a mind reader. Okay, so for them to effectively care for you, you've got to be honest and give them as much detail about your medical history, whether it be your sexual history, whether it be whatever habits you have. It makes no sense to lie to the doctor. I often tell my patient, I'm not the police, I'm not here to judge, I'm not going to lie. But what exactly happened? Give me the facts here. Don't withhold, because if you withhold information from your physician, then your management can change. What if an individual embarrassed to say they take a drug to help with their erectile dysfunction? If I'm prescribing a different medication, it's important, because what if it counteracts, and there is an interaction that can be lead to some ill effect. We want to be clear on all these. All of your medications, all of your health symptoms. If you smoke, you need to let your physician know that. If you use alcohol regularly, those are things, though they may be embarrassing, we're not here to judge. We want to have a totality of the picture on the patient, so then we can help make the best decision and assessment there.
If I feel good, why should I come to regular checkups? Why are they so important? Why?
So avoiding regular checkups, Hortensia, because then that happens, and we mentioned it earlier, you want to pack everything in one visit. So when you have your regular checkups, your doctor has a good understanding of what's going on with you. It is not the same if you come in once every 3 years and then you have to play catch up. But if you're regular with your screenings, you're getting your mammograms ordered, you're getting your PSA checked, which is checking your prostate. You want to check any necessary screening tests that you know, checking on your blood sugar levels if you're diabetic, making sure that they're all in good standing. Instead, you come in once every 3 years, your doctor has to play catch up, has to do so much at once, and to get a picture or understanding of what has been happening in the last 2 or 3 years. So regular visits actually help, and you can address any issue or health condition as it arises and correct it.
Exactly. Slacking on our daily wellness habits. I don't want to eat good today. I'm not exercising.
You hit the nail on the head. Overall, I tell patients, and listen to this, that your physician is there with you most 20, 30 minutes for that visit. You have to live with yourself. The physician would advise and support, and that is our job. Ultimately, your health is your responsibility, so you take charge of it. How you eat, how much you exercise, what is your diet like, are you taking your medication, okay? So then patients will come to the doctor and they know, oh, I have an appointment on Wednesday. Let me take my blood sugar medication now so that when she checks it in the office, it's normal. But you haven't been taking it for weeks ahead. So that little finger prick that we do and check the GMR, it's normal and you feel good because the doctor saw that it's normal. So but you are actually tricking yourself ultimately, because the uncontrolled blood sugar over that length of time is actually creating harm in your body. So it is important that you do not slack in your wellness habits.
Okay. Well, I have this little thing here, but I have it for a good reason. But sometimes we're in the office with you, we're on the cell phone, we're not listening to you. And you said something, but we're busy texting back to somebody, playing a game, doing whatever.
Yes, and it has happened in the office. The patient gets a phone call and they have to take it and they distract the conversation. What happens then? Once you get off the phone, you've lost your train of thought as the patient, and then we're trying to play catch up and something important would have been missed. So at that time, if you're in the waiting area, you can be on your phone, but you put it on silent, and once you start having that dialogue, it is both respectful on both ends, that there is clear communication, there is a listener, and there is someone who's talking, so the communication can improve. So you want to leave that cell phone aside once you're visiting with your physician.
You think we should put up signs that says, put your phone on silent before you enter the doctor's office, just like some institution has up something like that?
Yes.
Or that might be too harsh for people?
No, well, even if you're waiting in the waiting area, you should have your phone on silent. If you're playing a game, if you're looking at something on social media, have your headsets in so that you don't distract. You remember back in the day, you had the magazines in the waiting room. They no longer use that. Everybody wants to know if you have Wi-Fi, they want to log on, and they want to use their social media as they wait.
I went to the doctor's yesterday, and the office had a sign that says to have the cell phone.
Yes,
level.
okay.
Yeah, because I guess
it can be distracting to others.
It certainly can be distracting. Alrighty, so let's talk about seeing you in public and say, Doc, you could tell me what's wrong with me. This is what's going on.
Think about that. We're in the supermarket, and it has happened to me many times. And I'm just going along the aisle, and a patient comes up to you, or an individual. I say, Doc, I was supposed to come by you, but look here, look at the swelling in my hand. What do you think it is? Can you tell me? And then what happens? That could be very detrimental. One, and I like to tell patients, the streets is no place for consultation. One, the doctor is giving you an off-the-cuff comment, and you can run with that and take that as a diagnosis, and then you do not come in. And if later it turns out to be something more severe or something detrimental, what is the patient going to say firstly? Oh, well, the doctor had said, but there is no documentation. I like to tell persons, come in so we can sit down and have correct documentation. All right, so that is not the place to stop the doctor and say, Doc, what you think? My daughter was having some earache and something, and it happens. And we're humans as well. We may need a little downtime, so the supermarket or the parking lot is not the place for that.
Okay. Let's talk about bypassing and disrespecting the nursing staff. I know sometimes we have some rude nurses. Yes, I said it. But why should we not disrespect them?
Because they're part of the healthcare, and they're healthcare providers in their right. It's not just physicians. And persons may sometimes think because they're nurse, they're underqualified. That is not so. They chose to be nurses. It is a calling. It is a passion for some persons. And you've got to think of the healthcare like this. It's a continuum. The physician is not there 24 hours of the day. So your nursing staff continues, and that is why that is important. And I said this, Hortensia, because this one is important. I've sat in my office and had patients call the office with a complaint, but have not gone to the nursing station and addressed the complaint. And I said, no, the nurses are there. You need to first speak to the nurses and let them correct whatever the issue might be. The nurses are very intelligent, so you need to ensure that you communicate any complaints so that that can be taken care of. Or else your doctor can become overwhelmed, hence the burnout, because there are lots of issues that the nursing staff can deal with that do not need to get to the level of your physician at that point.
I'm sure some patients might say sometimes the nurses don't make you think they're approachable. Like they have on faces that you're frightened to go and even ask a question.
I do not think so. I do not think so. But everybody can have an off day, Hortensia.
Yeah, I know. Okay, pretend to be clueless as to what's happening to you. Like, I don't know, I don't know.
No, well, that's not that one. This one that speaks about pretend to be clueless. This is a very interesting one, and I've had it happen to me. So, for example, I'll use you. You come to see me with your mother. So your mother is the patient, Hortensia, and we're having a dialogue. We're discussing her complaints. And then you say, well, Doc, Sister here, by the way, what's going on? Look at this thing on my foot. I've been having it for several months now. Look at this rash. What do you think? And they essentially are inserting themselves in the mother's consultation and taking the attention away from her and asking for a consultation themselves there. Almost like a 2-for-1 if you think about it like that. And that it also takes away from the main issue at hand, okay? So since I'm here, Doc, look at this thing for me. Similar like when they stop you on the streets.
Oh, boy. Let's talk about exaggerating symptoms as the patient, I would say, to get the doctor's undivided, full attention. Look at me.
Okay, and I'll let you hear this one too. Persons often come to the physician, and if you are very observant, you can see them in the waiting room, you can see them before you approach them, and they're laughing, they're talking, they're having a good time, and as soon as you get close, the symptom that a complaint, so we use a scale from 1 to 10, abdominal pain, you say, Doc, you ask, well, how intense is the pain? You say, Doc, it's a 10. But their demeanor, their behavior does not illustrate that it's such an intense pain. And there's often a secondary gain, a Hortensia. But we have to be careful because it's the boy that cries wolf. Yeah. And I'll give you this because this has happened to us before. I haven't worked in the emergency room for years, but when I did, patients back then, when the waiting area was full, so you're with me, when the waiting area is full, these individuals will go back home and call the emergency line and call the ambulance so to come for them and bring them in the back because you're thinking as a patient in the emergency ambulance, you would be attended first. Yeah. And those things are not correct to be done because it can be misleading. And you can create problems overall for your health care because if you exaggerate your symptoms for secondary gain. I've seen young females, they have their partner there and they want to pull him in with their emotions and they're being ill. What if he was trying to break up with them? No, I'm sick. He has to put that aside. He has to pay attention to me. There's a secondary gain, so we have to be careful. This is not the time to play around. So if your pain is a 6, say it's a 6. Be very specific and precise because what does that do? Avoid unnecessary testing, avoid unnecessary intervention when they weren't warranted. Okay? Exactly. So honesty is always going to be the most important here.
Let's talk about waiting. I don't understand. Why do we get appointments when they don't match the time?
Hortensia, that's where we would have to take some responsibility, but lots of things. It's a two-way stream. Remember, it takes two to be involved in any communication, any relationship. So you're in the waiting room, and a patient comes to me, and I remember having this discussion. The patient said, fussing and started saying, "Doc, I was out there so long, something." I asked, "So what is that room called?" He said, "What do you mean?" I said, "Where you were sitting, what is that room called?" Then he seemed like he caught on, because it's the waiting room, so you should wait. So he was upset. But I'll give you the other side of it. There are times you can't help, because a consultation might be a little bit more complex, and each person may be different. You can pick up time with a person that comes in prepared. You can save time on that. The person who've had regular checks, so when they're coming in today, it's for something specific and not and something that could save time. But you also have to remember, as a patient, when you come down, you've got to remember others are waiting. Cadencia. Because once you sit down, you forget that there are others, and you want to go on and you want to share everything with your physician, and you want to get all of the psychological support, which is important, all the counseling that you can get. But you've got to remember that it works both ways. So you've got to think about your fellow men who are waiting outside as well.
Yeah. Oh, boy. Ooh, this one is a rough one, and I even hear it from the wax techs. Not clean up. Well, you didn't clean up before you come see the doctor. So let's say you on the construction site, you come in your construction clothes to visit the doctor.
Well, I don't want to pinpoint any particular group, because the construction workers not necessarily so. But
I was just trying to find the group that would have the most on them.
Think about it, Patrick, also. We've had situations, and it happens in the institution as well, too. So you're working in the hospital, I go to do rounds. But I want to take you back to the time of old Hortensia and Patrick. Back then, what happened? The nurses would get the patient up. The patient would get tidied up at 5, at 6 in the morning. So when the doctor starts rounds at 8, they were fresh, and they would have a good conversation, and the doctor can examine, evaluate the patient. Persons are not doing so now. They're not willing at times. If the nurses would say, go and take the morning bath, they're still sleeping because they stayed up late, and they do not. And so you go to a patient, and you're supposed to examine them, and they're unkept at that point. And it makes your examination very difficult. You also remember, I remember as a child, when you went to the physician, you would dress in your nice little church dress and your nice hard shoes. Do you remember that? It was always a pride that you tidied up. So what we recommend, you take a bath as close to your official time. If you work and you ask permission to leave the office an hour before, so you can go home if you live close by and tidy up. If you can't, there's all sorts of different wipes. You try and tidy up as well as you can, so that when you bring a change of clothes, a change of underwear in your work bag, and you can do that because it shows that you respect the physician, and you also respect yourself when you go for that visit.
I'm guilty of this. Self-diagnose.
Self-diagnosing. Almost everybody comes into the office with already a preconceived diagnosis. Here's where we can go wrong with that, because persons Google their symptoms, and Google follow your algorithm, and it could take you down that bad path where you're thinking that even the simplest symptoms, the mild of symptoms, you may think that is something much worse. And you come into the evaluation with your physician, your anxiety is heightened, you're all stressed out, you're worked up, and then you almost force your doctor's hand to order unnecessary testing, unnecessary evaluation, because what? You are so worried about something that just might be something mild or something benign or non-cancerous, and because of that, you may make that the visit go downhill basically, and create lots of it. Because sometimes you go to a physician and you say, "Doc, I feel this thing, what you think, whatever." The doc may think it's just a muscle spasm or muscle cramp, but because you've heightened yourself, "Oh, I'm having a heart attack," you've made that such a fearful thing. Now you have to do an EKG, you may have to do an ultrasound of the heart, we call it an echogram, and that thing can make it much more complex. So we know you want to be the informed patient, and it's important, but you don't want to self-diagnose. Also, it is bad because you come in with a preconceived diagnosis and you want to insist that the doctor treat it in such a manner. And what if that's not so? Okay, and you can create this whirlwind and you spiral out of control, and then you have a misdiagnosis because you came in with already an idea. So you got to keep your mind open in the visit and be receptive as well. You can also challenge. We're not saying that you can't challenge, because you have to be your advocate, but you've got to also come with an open mind.
Okay, so
yes.
Don't come with your own self-diagnosis. I like to go to Dr. Google and find out.
Yeah,
what's
so
happening.
Patrick, any thoughts on what we've discussed so far?
Well, in listening to you, I realized that even though you're a doctor and I'm an electrical engineer, that there are similarities in what we do. For instance, I'll show you. Recently, I went to a transmitter site, and we had some problems there. And the individual who normally works there, he was not too au fait with everything. But after testing the equipment, I realized that the STL was okay, the transmitter was okay, but some rain had fallen. And I knew that, well, if the transmitter is okay and the STL is okay, then it means water is in the cable.
Okay.
So I was able to do that analysis. The same way with a doctor. The information given makes it easier to do an analysis and come to a positive conclusion.
I like that. Excellent, excellent. I like that. So that is why we speak about speaking clearly, coming prepared, and making sure you give the facts.
Yeah.
Okay, without any fear at this point. And I like to emphasize, your visit should be confidential. Your visit must be confidential, because you have to be able to relate everything to your physician concerning your health.
Okay.
And that is part of our oath of standard and being ethical, okay?
Okay, good stuff. So let's talk about the patient side. It's all about the patients now. So I'm going to read the heading first. Habits that annoy most patients about doctors. Looking down on patients. When they say looking down, what do you mean?
Okay, no patient, sorry. So I'm on the side of the patients with this one. Likes to be treated like a child.
Okay. Right.
So remember, the doctor spend years studying. Sometimes they see a patient, and the patient may be a farmer. In whatever profession they are, they may think that the person is simple or less than. And you have to be careful with that. Okay, so you have to speak to the patient with respect and with clarity, and not just brush their symptoms off or minimize anything. So give them the facts, but break it down. You don't have to use all of the medical terms, but break it down, make it as simple, but make it clear so that the patient can understand. And do not withhold anything thinking that the patient doesn't have the intellectual ability to understand that. So that I would encourage all of us as physicians to do.
Some of us went on Google. How about being difficult to reach? Because, you know, sometimes we're trying to reach our doctor, and we can't reach our doctor, and we call the secretary, and the secretary gives us a runaround, and then we try to call our doctor again, and we can't reach our doctor. How can you put our minds at ease and help us to not worry so much?
Okay, being unable to reach your physician. The physician, okay, you want to have availability to your patient. And we, as physicians, we at fault at times for that. We do the proverbial being busy. But we have to have discipline in this profession. This is a high calling. If you tell your patients that the office starts at 10 or 11, you should be there. Unless they're very extenuating circumstances where you're unable to. It doesn't mean that the doctor gets an out by saying, oh, I was busy. Oh, I'm a physician, I'm busy, I was there. No, you have to plan your schedule and plan your time accordingly, knowing that you have an obligation and a responsibility to the patient. So that is being available and accessible to your patients. But they are office hours. So at times you may not be able to get the physician at all hours after. I recommend, if there is an urgency, an emergency, we have the hospital. You can always visit there, and you can mention, oh, I was seen by Dr. Osborne today, and she suggests this and this, but when I went home, this happened. Is it possible you can reach out to her? Even the physician who's there can reevaluate you. That would be my best advice in our setting, since the doctor's office is not going 24 hours a day.
All right. Oh boy, sometimes we think you're not hearing us, you're not listening. Okay, let's take the call. Caller, good morning. You're live on Weekly Dose.
Good morning to you and your guests. The doctor mentioned something there that may have sounded a bit conflicting. Basically, when you go to the doctor for a particular ailment, you're not supposed to distract the doctor with other things. But isn't collecting the history of the person just as important? And shouldn't you distinguish between a visit to the doctor for an ailment as opposed to going for a checkup? Because, I mean, I've known a physician who, when you go to him for an annual checkup, would ask you things like, have your foot, your shoe size increased? Are you happy? You know, things like those, which normally one might find outside the realm of well, from a layman point of view anyway, outside the realm of medical stuff. So does that conflict in not trying to distract the doctor with side so to speak?
Okay, I like that question. Thank you for that question. Okay, I like the gentleman's comment. Two things can be true at once. There is your annual physical, true, and when you come in for a specific issue, all right? So we can separate those both. Okay, because the patients have come and said, Doc, I'm here for my physical. And then you do a thorough review. And that question that the physician asks, if your shoe size has changed, that tells you, do you have swelling to your feet? Because if this patient, because it all ties in, is this patient hypertensive, have high blood pressure? Could they have any signs of heart failure where they're retaining fluid and they think? So that makes sense. So all these are ways that a doctor can communicate to a patient. That is important. When we spoke about having too many complaints, having too many complaints at once, that was that we may miss the main thing, and we still have to be careful about that. Because we do not want you to be having chest pain and an MI or a heart attack, let's be frank, and we are focusing that you have chronic arthritis and your knee is hurting. That's all I want to make that distinction is. So we focus on the main complaint. We know that there's secondary complaints, and hence one of our discussion was also having regular visits. We mentioned that as a point, so that you do not try to throw everything in one visit. Hence, we may miss things, and we do not want to. So having your regular annual visit with your physicians and your check-in, it helps us to stay at track of everything. Because when you come in, for example, once every 2 years and you're hypertensive, you're diabetic, you have high cholesterol, then it's a whole lot you have to deal with at once, and it makes the visit very extended, very overwhelming for both the patient and the physician. So regular checkups, and we can address more of your concerns like that.
Okay, so what about the last one that we were just speaking about before we got the call? The patient presuming that the doctor isn't listening.
Oh, yes. We doctors, we're guilty at that, as most persons are.
We all are.
The room is filled, the waiting area is filled, as we spoke earlier, because nothing is in isolation. You want to come down, but you want to stay long. And so the doctor is trying to get through. So the doctors, we do have to listen so we do not miss any of the salient and important complaints that the patient may have. And it harkens back to being prepared as the patient. So have your salient points and questions listed down so that we can make the main thing the main thing. Doc, I've been having all this chest pain for 6 days, and it mostly happens at night. You have your main symptoms there, so we can explore and analyze that, okay? And so then the doctor is forced, because the doctor then realizes that you're not talking all over the place, helter-skelter, you're being precise, and you are prepared. We started by saying if the patient is prepared, the evaluation goes much better.
Yep. And
so we have to listen as physicians as well too.
Okay. All right, I like that session this morning. So I hope for those of us who are listening and that we will eventually become patients in some form or the other, that we'll go to the office prepared. Okay. Caller, good morning. You're live on Weekly Dose.
Good morning.
Good morning. Good morning, Dr. Osborne.
Good morning, love.
Do you need a prior recommendation to do what they call it now, colonoscopy?
No.
Or can you come directly to your office?
You can come directly to the office. We do not have that block, so a patient can see anyone who they want to see. There is no limitation in you saying that you have to see.
I know sometimes they say get the thing from your doctor, but a referral before you come.
A referral. I understand that. But that should not and cannot. What if you cannot reach your primary care physician? What if your primary care physician is off island? So there is no reason a person cannot walk into any physician's office on a small island like St. Kitts and not be attended and have your concerns addressed and say, if I can help or if I cannot.
One major concern is the high cost of medical attention.
Mm-hmm.
I mean, while I understand you want to get through and you prefer for people to come back, some people had to strain to come in the first instance for them to be hustled out, and they must come back. What kind of allowance is made based on the person's economic situation? Do you all make any?
Okay, I like that question, ma'am. That is important. I've always said, and I still believe, and correct me if I'm wrong, there is no limitation in accessing health care. We've got the health centers that are covered by physicians. We've got the Paxton Health Center, the Mary Charles Health Center, and we have the Joseph N. France General Hospital. Persons can always access care. And even when I see a patient, I would say, okay, you can call if you're unable to come back in, because I know persons think about their resources. Because if it's just to get your results, you can call and follow up. So I could say, no, I checked them and all is well. So that sometimes it's in the care of the patient. I said, it's your health, you need to follow up. So at times the person cannot come back. But healthcare does cost. And it is worldwide, it is understandable, and we have to get a balance. And thinking that we're not, I don't think we're ever going to get a perfect system where we have universal health care and we eliminate private health care, eliminate private facilities. There must be a balance between
I think that is part of the problem. You know, a lot of our people don't have medical insurance.
Yes.
The medical insurance in this country, because I paid for years, decades. And from the time I hit 75, they said, well, it's lapsed, so it ceased. Are you aware of that?
Yes, I know that the insurance do terminate individuals after a certain age. That's a part of the business of it, yes. And
so while you might have had coverage for some of the things, I learned that the insurance companies, even if you have insurance, they do not cover certain medical procedures.
Mm-hmm. So that is why all the stakeholders, the policymakers need to come together. I think we had a discussion about that last week. It's a multidisciplinary team and everybody has to play a part. But to our listener here, I refuse to believe that in St. Kitts on today, the 15th of April, that you cannot get access to health care. I know that
especially surgery. No, someone was telling me they are giving one price for the surgery, and the next one for the theater, the next one for this, the next one for that. When people in the first instance, they don't have medical insurance, I keep pushing it, get insured.
Correct.
Whatever it is.
Yes, correct.
But people are faced sometimes with prolonging coming to a surgeon or even some doctors, because some of the fees just to go in and say good morning, my belly to me. To the doctor, it looks small. And when you begin to use the comparative statement like in other countries, all countries are not the same. All don't have access to the same things.
Yes, I agree with you. You have to think of
I
the
think some consideration.
Yes.
It's supposed to explain to you the situation, and you investigate it because you can't just swallow everything.
Okay.
then allowance should be made, some provision. Maybe payment
I
on a
want
plan,
to
put them on a plan or
emphasize, though,
something.
my dear, I want to emphasize that we have the health centers. We also have the clinics at the Joseph N. France General Hospital, that all specialized areas have a clinic day, a clinic time, so the clinic is accessible
I'm sorry you missed what I was saying about the same clinic day. When you having less doctors working in the clinics.
She's saying there's a shortage of doctors because the doctors have
Oh,
to
you didn't hear me, no?
themselves. I don't know. I don't think she was listening at that time. Remember, she has to get here, so maybe she was busy.
I know,
Oh,
but
that was the
I-
previous show?
No, just
No,
before
just
you
before
came
you
on.
came on.
I
Yes.
don't know if you heard talking about the doctors
No.
overextending themselves. It seemed
Yeah,
there seemed to be a
whereas you had the
shortage of doctors,
in the
although we
clinic.
said they were.
You know, I have one.
We had enough.
Okay, I did not hear that
And then the
conversation.
crowd's
I was
still
on-
bigger.
Okay.
So the time it takes to get in, the doctor hungry and tired.
Got the
Rush, you
humans
got to
too.
rush. I
Yeah.
recall him and say, Mrs. Henny, you're getting old, Before so they expect you to accept certain things. As you say, give one thing and go carry the rest back home with you. All right, then have a good day.
Have a good day, my dear. Always a pleasure.
Oh my God! Give one thing and carry the rest back home with you, Miss Henry.
I like that.
Oh boy!
It's always fun to interact with the audience.
Miss Henry said carry back everything.
I want to end on a positive note, though. I still have faith in our healthcare system. It is not perfect, but we are continuously striving. And I still believe that we are better in a lot of other areas, countries, regions, because our patients can come in and get health care and get procedures done in a much a shorter timeline.
Yeah.
And we always have a door and some way to access our health care. Healthcare does cost, so we cannot dance around that bit. It really does cost, and this is international. But we have to have a price setting based on our socioeconomic standards. I do understand that we are a developing nation and our people still have limitations. And she also touched the point of having health care. Even when I'm talking to patients, I say, you may not need it for this visit, but you do need health care. What if a major incident happens, a major health crisis, you would need that health care. So we encourage persons to do that as well too. Okay? And not just think, I'm young and healthy now, so I do not need it, but it's very important because at some point you may. So that is how I would like to think about it. And I hope everybody had fun, and it was supposed to be a moment, just a different style of a presentation to make it lighthearted, but also to make reinforce that the empowered patient is the prepared patient, is a patient that comes ready and have their information, have all their drugs, know their history well, have a good, clear understanding of the timeline of their complaint. So you ask the patient, so when did this start? A while ago. A while ago is not an answer. So have these things timed and written down. So be more specific. So I wish everybody a great day, Cartensen. It's always good to be here with you, with you and
to
Patrick.
you as well. Yep, and thank you for coming and educating us. We appreciate it so much. So now we can go to the doctor's office prepared, and as Miss Henry say the one thing, carry us back home.
WINN is 98.9. 98.9 is Win FM.
Ready to save while you build? Now you can at Builders Paradise. Yes, shoppers, build up your Value Club points at Builders Paradise. That's right, Value Club members and shoppers, your favorite frequent buyer club is now available at the home of hardware and more. Whether you're laying tiles, painting walls, replacing doors, upgrading windows, or fixing up your home, every purchase at Builders Paradise now earns you Value Club points. Enjoy exclusive benefits like discounts on thousands of items, special savings for seniors, instant deals, quarterly rebates, plus an extra up to 2% off every quarter. Shop more, save more, and more only at Builders Paradise. Don't miss out. Start building your rewards today with Value Club at Builders Paradise, because every bolt, board, and brush brings you closer to bigger, better savings. Terms and conditions apply. Say kids and neighbors, it's time to celebrate!